Thank you, Matt. The air conditioning got the better of me and I needed a tissue. I thought you would prefer if you had a little wait without my nose running while I talk to you. Thanks, Matt. As Matt says, we are absolutely delighted to be doing our first hybrid event. And our last face-to-face conference was way back in 2019. And I think, just to echo what Matt said, to say that we're a little bit rusty, I think the team have done an amazing job. And I am the luckiest chief executive in my sector, without a doubt. My staff team, the volunteers that support us, the people that come to our events are all absolutely A1. And for that, I'm intensely grateful. I'm also very grateful for everybody who's joined us today, whether you have, by some way, miracle, got rail travel to work, or through Wi-Fi, which we've all become so dependent on. I'm extremely grateful for all of you to come today. I think there's also a group of people that I would like to thank that without their financial support, ongoing through COVID, and obviously to help us put on this show today. And so a very special thanks to Janssen, Novartis, Procure, Santen and AGTC. We just can't do this without sponsors who help us fund it. So I'm extremely, extremely grateful to them. And as you all know, we don't make a charge for your attendance at these conferences today, and nor would we ever want to. Our events are to be open and accessible to absolutely everybody. But we are a charity that receives no government funding. So if you or your organisations can support us, we would be extremely grateful. We have a really friendly team out in the exhibition centre, so if you'd like to go and speak to them, visit our website, and in your little bags there is a little envelope if you could support us. We'd be extremely grateful, and it is down to these voluntary contributions that we can do all of the fantastic job that our staff and volunteers do. And many of you do know us, and Retina UK is an extremely unique charity. And that's not just because we are the only organisation in the UK that funds research and supports the IRD community exclusively, but because of where we've come from and what we stand for. 46 years ago, a lady called Linda Cantor started something for a group of people where previously there was absolutely nothing, apart from a well-wish, a diagnosis, and more often than not, an advice of go home and prepare for blindness. And she decided to change that, and change it she did. And it's still that same ethos of togetherness, supporting each other, and the charity being right at the centre of the community, listening and reacting and pulling that community together that makes us so special. There's a mutual motivation that moves us forward, that has helped our charity grow over the last half century. And this helps us ensure that we're able to respond to what our community, our boss, really wants us to do and help fund. We are entirely committed to listening and supporting and continuing the search and delivery of treatments on behalf of the community. And most importantly today, supporting your endeavours in what you do for our community, for which we are extremely grateful, and we know how hard it is for you. Recently, we had our volunteer training weekend, and this is where we get an opportunity not only to ensure that our volunteers are up to date with the most recent information, but also so they can update us anecdotally where we're up to. And it's opportunities like this to get feedback, along with our sight loss survey, that helps us create content for you, their professional concepts, and make sure that that's useful, relevant, and now, as Matt says, comes with CPD points. So we're incredibly pleased with that. Retina UK is an organisation that has two main pillars, and that first one is Hope for Tomorrow, and that's us funding research and aiding the way by ably getting treatments to market. And we do have one treatment at market specifically for the RPE65 gene, and the content of our previous sight loss survey was an element that supported the passage through the notoriously tricky NICE process into clinic. We will continue to drive research and hopefully in the future, many more treatments for this group of conditions, so they all eventually become treatable, and in essence, the symptoms become avoidable. We have a long way to go. So we also have our second pillar, which is about living for today, with a range of services, events, support mechanisms to help the IRD community live their best lives today. You'll be hearing about this much later on today. So, without going on much more, I'm really excited and a little bit privileged to give you some of the top line results from our very recent sight loss survey, which is still extremely hot off the press. So this is our first analysis of it. At the end of the session, I'm hoping there'll be a couple of minutes. So if anyone in the room has a question, please get ready for that. Or if you're online, please use the Q&A. If you do have a more complex question or wish to speak to one of the team afterwards, then please do so. But please bear in mind, we're right at the beginning of getting to the nub of what the sight loss survey means. So I think, do I press next? I'm looking at Matt. I think we're going to give it a go, see what happens. There we go. So what I'm going to do today is I'm going to look at the views and the experiences of people affected by inherited sight loss. And this is our survey findings, and we have some learning objectives, which I'll take you through in a moment. Okay. So one thing that Retina UK does recognise is that everybody here in this room today is extremely busy. We all have very, very busy work lives. And the fact that you've taken the time today to increase your knowledge is very much noted and appreciated. And I've got here to remind you yet again that it's CPD, but I don't want to go on about it. It'll come up lots in the future. There are 5.5 CPD hours for this event, and we're so delighted that we can offer that for you now as well. Retina UK is here to help you support the IRD community and the unique challenges around progressive sight loss. We listen to our community and respond to their needs and wishes, and this conference was born from that very ethos, encouraging and facilitating the very best information and support for professionals who wish to do their very best for the people and the families living with inherited sight loss. Interacting with professionals is an activity that led straight from the feedback we received from the community. Living with a rare disease is hard, and it's made harder because of the nuances and the specific challenges that tend to be really niche and not easily accessible information. And us being able to offer this information, signposting and awareness is an activity that we take incredibly seriously, and we are glad that you do too. Please work. Just going to wait for my next slide. There we go. Lovely. So today's objective is to identify the key challenges experienced by people living with inherited sight loss and being able to proactively address these in your day-to-day work. We at Retina UK live and breathe the experiences and challenges of the IRD community and what they live with, And we do this by a number of means. We have events, we have feedback, we have contact. And more formally, we test our thinking and hypotheses by undertaking a sight loss survey. This helps us build the charity the way the community needs and allows us to access invaluable insight into where there may be challenges and maybe even some positives that we can build into our services and our activities. It also gives us the opportunity to share this valuable information with professionals they may come into contact with. And more recently, it's even helped us influence at regulatory, government and NHS leadership level, where we can help make life better for people living with inherited sight loss. So the sight loss survey. So we have completed now 2 3-year tracking surveys to really get under the skin of the challenges. We had our first in 2019, and as I've said, we're very excited to have our second straight off the press, and that happened in 2022, so is absolutely up to date. The amount of responses that we had is 1,700, and that over the 2 surveys, and that gives us, very importantly, statistically viable samples. This is so important because it means we can better rely on the analysis and we can see trends and patterns that may help us when we're planning and sharing information with groups like we are today. So the learning outcomes for today. The challenges around genetics and getting a diagnosis and understanding that diagnosis and the importance and difference between that and genetic counselling is a major part of the successful delivery of treatments on so many levels. And it's important also for aspects of life. So when we think about genetic testing and genetic diagnosis, we immediately go to the science. It will help us find treatments. It will help with clinical trials. But there's also a really deep peace of mind for knowing that you are in the system for when clinical trials and treatments comes up. And that comes along with a load of familial benefits as well, which we'll talk about a little bit later on. There are inevitable psychological impacts, not only to the individual living with the condition, but also their family. And what we're going to talk about today is how we can improve upon that situation. The third is the impact of diagnosis. So I think that in this room, there are people who have heard us speak before and have heard about the point of diagnosis and the challenges around having an untreatable condition and how difficult that is not only for the patient, but also for the clinician involved. In addition, 74% of respondents told us they weren't told about us at that point. And because we know, because we've seen the data, that 9 out of 10 respondents feel better informed because they're in contact with us, and a quarter feel specifically more confident about their condition, we know the positive influence a referral to Retina UK can have at that point. And we'll be talking a little bit about referrals and signposting to us later on. We'll also learn a little bit more about the services that you provide, their usefulness, as well as the services that the responders feel are more elusive or they didn't even know existed. And then I will give you a very quick whistle-stop tour of the services that we provide that will be useful to you in supporting your clients in the best possible way. There is a session about this later on today, which Paula will be leading, which will give you much more in-depth information. And then just a little bit more information about Retina UK, and I've kind of slipped this one in, because we're really confident about the quality of our services. Our community tell us that our services have a positive impact on their life. And I just want to share with you some of the statistics so you can hopefully feel confident that when you signpost your clients and the families you're in contact with us, you know they're getting the very best service and they get a say in where the charity is heading and what we do. Okay, so let's get on with our learning objectives for today. Let's talk about genetics. Okay, so as an inherited group of conditions, it is so important for the community to have a genetic diagnosis, or at least the choice to have a genetic diagnosis. It helps researchers understand the disease and its mechanisms. There are benefits much further down the line in terms of market analysis for organisations that are actually competitively looking at treatments for this group of people. It can offer access to clinical trials and hopefully future treatments. But also, it can help the family and the individual in terms of maybe helping them with their symptomatic prognosis. Maybe it could help with family planning. It can give all sorts of peace of mind benefits of just knowing that you're in a system. And having the choice of having a genetic diagnosis is one that we feel is incredibly important for this group of people. Almost a third, 31% of respondents, could name the gene or genetic disease type causing their sight loss. And this is twice the percentage in 2019. And suggests a positive increase in the number of people who were given a genetic diagnosis, or at least know and understand their diagnosis. We are delighted that our Unlock Genetics resource, which was developed as a direct result of the 2019 survey, is now helping people understand their choices. They estimate, and having a positive impact on their diagnosis journey. Please visit our stand. There's lots of information and postcards that you can take away, or visit unlockgenetics.org.uk for further information. It's really clear, it's really easy to understand. It is a complex issue, and maybe, no, I'm not biased at all, that resource lays it out absolutely clearly what it's all about. The team have loads of information, as I say, that you can take away with you. You can take a small stack if you know that there are individuals and families that need this information. So, in brief, we know that increased knowledge increases confidence. In asking the right questions and getting on a path to a diagnosis and understanding what it means if you choose to get one. There is still a long, long way to go, but huge inroads have been made to ensure that the community is better equipped, has a genetic diagnosis, and are aware of research and clinical trials. So the other side of this coin is the scientific progress, finding those genes. And in conjunction with our activity with the community, Retina UK also funds the UK Rdc Consortium. That is a group of the top institutions in the country who collaborate fully to find, well, what I call shy genes. They don't immediately present themselves, and new gene defects that can cause this group of conditions. They estimate that because of that project, around 70% of genes are now diagnosed. So we are getting there, and the connection between the community awareness and participation and the scientific research for genetic diagnosis is vitally, vitally important. So like we say, there is a long way to go, but most clinical trials are not possible without a genetic diagnosis. We know this is important to the community, so please, please facilitate. Ask the question, do you happen to have a genetic diagnosis? Do you know about this? Have you had that choice? And if they're not aware, send them to Unlock Genetics to get a little bit more information. It's accessible, it's easy to understand. If that's not a route, please put them through to our helpline for a chat of somebody who not only is in the same situation, but also has the information to be able for them to take forward. And also, encourage them to ask questions of their clinical contacts. Nurses, eye clinic liaison officers, as well as their ophthalmologists are all good sources when you know what to ask. And I think that's the difference. What we're trying to do with Unlock Genetics is offer that choice. Give people confidence in their condition because they understand what they're asking for. It really does make a huge difference. So the psychological impacts of the condition. So there's some really high numbers here. Anxiety, loss of confidence, and stress are the biggest emotional or psychological impacts of inherited sight loss. And only 7% of our respondents say they have experienced no impacts like these. Or to be put the other way, 93% of our community who responded to our survey said that they had had some of these psychological impacts. The number is very similar to 2019, although there has been a marked statistical increase in people experiencing anxiety. There's been a 7% increase in anxiety from 71% to 78%. 78% in 2022 and 71% in 2019. We think this might be, well, we're pretty sure it probably has pandemic links to that one. The pandemic had an immediate effect on our community. Our helpline calls raised exponentially. The sight loss community in general had a much harder than average experience of lockdown due to their sight loss. Social distancing, guiding, all became extremely difficult. And right at the beginning of the first lockdown, there were issues getting people with sight loss on the priority grocery delivery service. We started to engage successfully online with our community, and we believe that this activity really helped. However, we know we needed to do more. Our new Discover Wellbeing course aims to enable support for our community directly to better manage the emotional impacts of living with these conditions. I'm not going to talk too much about this, as it is covered in the next session by a brilliant and brilliantly informed panel. But I will, however, share a soundbite from the Discover Wellbeing course, which I think sums up what we're trying to achieve. And I have to admit, it's been shamelessly stolen from Mary Thurston, Dr. Mary Thurston, who is in the next session. And she says, when your head is in the right place, you can achieve anything. And that is exactly what this new project is aiming for. As I say, there'll be lots more on that later, and the team who have produced this amazing project will all be here so you can have a full discussion and really get under the skin of what that project achieves for our community. On a positive note, and when I look at this screen, I'm glad there is a positive note, those who have engaged with Retina UK are less likely to say they have experienced loneliness, isolation, and depression compared to those who have not engaged. And I think this is another really strong reason to utilise the services that Retina UK offer. So let's try all together to maintain a positive well-being in a positive way together. There'll be more detailed statistics on Retina UK later along with detailed info of our services. I think the one thing to say about what Retina UK does with psychological impacts is what we're aiming to do is stop people getting to crisis, where we can't take referrals. And I'm sure that all of the professionals in the room that are dealing with this have staged referrals to make when people are in psychological crisis. We are aiming to stop that happening in the first place. So, how can you support us doing this? By signposting the Discover Wellbeing project, which is in the next session. We have a helpline and talk support services. So the number is on our website and the team have information for you to take away with. And I think it's important to let you know that our helpline volunteers all are intimately involved or live with the condition. So they really understand from an innate living point of view what the caller is going through and was able to help them. Suggest attending one of our face-to-face meetings. We know that our community values meeting people in a similar condition, with a similar condition who are suffering with similar symptoms. So we know that that conversation really does work and has a positive impact on the community. Know the signs. Now, I think that when I wrote this down, I know for a fact that the people in this room know the signs much, much better than I do. So please stay awake for them. And you do have something that you can offer if you are picking up on that. And of course, we all know about the active listening. So if you do hear that and somebody is starting to make sounds that they may be struggling with some aspect of their condition or living, this is where we can step in to stop that crisis point ever happening. And that's really what we're aiming to do. So, point of diagnosis. Excuse me just for a sec. Okay, so this is a point of disappointment for us. I'm going to be absolutely honest. When we look at how the point of diagnosis has worked, if you have a look at the screen, I'm going to explain it for those who can't quite see the screen. Everything has gone downhill in the last couple of years with this. The previous 20 years, we had a positive trend in people's experiences of having a diagnosis, and that has not continued. In fact, the evidence shows this is reversing. Ever since I started at Retina UK, I've been receiving anecdotal stories about point of diagnosis. One of our old trustees went to have his diagnosis maybe around 25 to 30 years ago. And he went for his diagnosis and his mother had the same condition. And he was told to be sterilised so that genetic defect that went through his family stopped. And we hear similarly brutal experiences of a point of diagnosis. Our founder, Linda, felt so strongly at her point of diagnosis when they said to her, well, it's RP, go home, and at some point you're not going to be able to see anymore, that she decided to change it, and that was 46 years ago. So we saw a positive increase. We knew that that was improving, and that stopped. People diagnosed more recently were less likely to believe that the person giving the diagnosis understood how they felt, or to be told about ongoing support available to them. Now, having had a look at this, as you can see, there is a sharp turn-off in I was given the opportunity to ask questions. This person given the diagnosis had a good knowledge of my condition. The person given the diagnosis understood how I might be feeling. I was told about ongoing support available to me. I was offered emotional and psychological support, and I was offered genetic counselling. All took a dip. And I wonder if this is due to the pandemic in some way. We know that face-to-face appointments and going into clinic became rare to absolutely extinct, and maybe the online experience wasn't as effective and pleasant as it would have been to see somebody face-to-face. But we need to keep an eye on this, because we're saddened but it makes us doubly determined to help the professionals who have this incredible, difficult task of making a diagnosis, which will always be incredibly difficult, but at least we might be able to make it more informative, more guiding. What makes it so difficult is that the experience is totally overwhelming for both parties, and having a solid referral to make can be helpful not only for the patient who is looking for support, but also for the professional's peace of mind. And Paul is going to be leading a session telling you much more about this later on. We continue to strive to influence this, and we are involved in conversations with sight loss sectors to understand how we can work together to make a positive change. And I think there's 3 words, and I'm going to say them a lot. If anyone's counting how many times I say a word, the word referral and the word signpost are going to come up a lot, because we feel that if people aren't told about us at this point, it is an opportunity for both parties. Whenever you come into contact with someone who's professional, please don't ever assume that in clinic there's been a referral, or that another one of your colleagues, maybe in social services, have given a referral. Please just don't assume that this happened, because I don't think it does. We know that we've got high satisfaction rates, but not enough people in the community know about us. So please, if they hear it 2, 3 times, not a problem, but please continue to refer to us. So let's talk about services. Okay, so let's have a quick talk about the services. This is just an overarching, very top line. If you do need some more information, please do speak to one of the staff team afterwards. We may not be able to answer massively detailed questions on the services you provide, but we can certainly look for it and get back to you. So by far, the service that made the most positive difference was claiming benefits. Any advice on how to claim your benefits was massively well received. 87% of our community found it made a positive difference. But 36% weren't aware there was a service or told us it wasn't available to them. So if we look at that number of 36% and 87% of them, that is a statistically viable large amount of our community that aren't aware that these services to help them through that system are there. Second was mobility training. 54% accessed it, 34% were not aware of it, or that it was not available to them. Now, my top line thinking on this is that it might be a symptomatic stage of where they are with their inherited retinal dystrophy, but we also know that 85% of people who access mobility training found it to have a huge positive experience. So when you're speaking to your clients and your families, sometimes it takes a little while for people to get their heads around doing mobility training. People try to be independent for as long as possible without aids. It really does make a positive difference. So please bear in mind that a huge 85% of our community who access mobility training found it to be a positive experience. iClinic liaison officers, 43% had accessed and 60% said it had made a positive difference. So if there are any iClinic liaison officers or ECLOs in the room, well done. That's a huge positive difference you're making to our community. And we know at Retina UK that the demand on ECLOs is much higher than the current capacity allows. And I know that work in that area continues with my sector partners. So, in brief, advice on claiming benefits, mobility training and ECLOs, very high satisfaction rates, makes a huge positive difference. But they also struggle to access ECLOs. I know you're absolutely stretched. Genetic testing, genetic counselling, and social support services all seem to be elusive to our community. So I'd be really interested if anyone's got any ideas about how we might be able to help that status quo. I'd be really interested in having that conversation. So, signposting to Retina UK. In 2019, 74% of respondents were not told, that there was support available from Retina UK, and a third of people said they would have liked this. What is super disappointing is that less people are being told about Retina UK from health professionals than 20 years ago, and more likely to have found us through an internet search. And although this is great, our internet's working, that's fantastic, it's not ideal. Our satisfaction rates are fantastic. We make a positive difference, but if the community don't know we're there, then we need to really change that. We want to have a positive impact on absolutely everybody. We are going to have a new website. It's, I believe, and I'm not very tech savvy, as my staff will tell you, but our current one changed when we changed our brand about 4 or 5 years ago, and I believe that's quite geriatric in web terms. But our new one will be fully accessible and will give you the best experience possible. But our current wealth of information and on everything from research to webinars to sports services is still really accessible on our current one. So please do have a look at that. And Paula will be telling us more about the website later on today. Okay, so we had a quick look at what aids people are using. And really interestingly is there's been a statistically significant increase in the use of smart devices as aids, notably smart home devices like Alexa and Siri and smartphones. So there's been over a 10% increase in use of these aids. This is a brand new sort of area of statistical information for us, so we're not sure what that means to us and what we can do with that information as we've just started our analysis. But we thought it'd be interesting to keep you updated. And I wonder if the pandemic, again, where people are at home, using home smart devices, might have had some sort of impact on that. Okay. So more about us. So this is where I sell us in as best I can with the fantastic information that I have, right? So, compared with 2019, more people agree that they have a big say in what our charity does. This is great news, as we really do pride ourselves on being led by the community. The original survey and the results have had a positive impact on this question because it had an impact on what we were doing. So my personal theory on this is in 2019, we asked this question, and asked them lots of questions into our community. And what they told us to do, on the whole, where we could, we did it. And I think that's been noted, and I think it shows in the increase in the number of people within our community who think they have an impact on our organisation, which is absolutely what they do. 83% of respondents rate our services as good or excellent. Increases in satisfaction and take-up of many aspects of our work and services compared to 2019. And obviously, we are absolutely delighted and really want to continue in this right direction. You'll be hearing all about our services and how to signpost later on this afternoon, and we'll be looking to increase that. Also, over a quarter of our community who responded have a greater confidence in managing their sight loss condition because they've got contact with us. And as we said right at the beginning of the presentation, confidence is really key. People know about their condition, they know what their choices are, that increases their confidence and also can minimise psychological impacts. And as I've said, here we go, I'm going to say the same words again, referrals are key. We can help you support the inherited retinal dystrophy community to the best of your ability by supporting areas where you need us as well. Okay, so very quickly, just going to run through our learning outcomes for today and take some of the key take-out learnings. I cannot reiterate enough the importance and benefit of having knowledge about having a genetic test, diagnosis or counselling. It helps in so many areas. In addition to the scientific benefits for researchers and scientists and clinicians, from family planning to at least some peace of mind that you are in a system, all have a positive impact on the future and the psychological impacts of the condition. The psychological impacts. There is a consistent cycle with degenerative disease where you get a diagnosis or you have a physical change in your symptoms. Then you have to get used to that. You have to make the practical changes, the emotional changes. You have to strengthen yourself against what's happening. And then you have a period of getting used to it, knowing full well that that cycle's going to go round and round and round while your condition degenerates. It's this cycle compared with the world that we're living in at the moment, the pandemic, the cost of living crisis, is something we have to be aware of. And we know it has a significant impact on the community. So please listen, refer, please have awareness, and of course, only when it is not a critical situation, please refer to our helpline, our new Discover Wellbeing project, and our support services. We know from the feedback that we get that the services and the ability and opportunity to meet people from the same group of conditions has a huge positive impact, specifically on loneliness and isolation and confidence in people's situations and conditions. Diagnosis, a very delicate issue for this one, but following on from our 2022 insights, we know we need to get a grip on this, and we will be focusing on how to improve point of diagnosis, to make sure that we're there to support professionals, patients, their families, to make this situation, it's always going to be tricky, it's always going to be difficult, it's never going to be pleasant, but there's things that we can do as an organisation that is aware, intimately aware of the challenges around these group of conditions. We can support that process and make it easier for everyone involved, and that includes the professionals. It's not an easy side of the bridge to be. Please signpost us, please signpost us. We really want to help and support you to help our community. And we know you do an amazing job with very little resources on the whole. So please, it is an opportunity to drive into resource that's there for you. The services that you provide. So please keep going. We know the benefits and mobility are key areas of benefit, but do not underestimate the power of any support. Being present, listening, being in the room with clients and families is one of the most important things that you could do for this group of communities. We know that on the whole, you're hugely overworked and under-resourced, and that is why we're going to try, as well as offering on-the-ground services, to try and influence for increased resource, awareness, and funding for the vital roles that you play. I think I'm about on time for questions. So thank you very much for your attention. I really appreciate it. If there's any questions, please pop your hand in, or you can speak to a member of staff. We've got a couple of minutes. Have I dumbfounded everybody? No? Sorry, there's a mic coming over for you, just 1 second. Hi.
Joanne from the Coventry Sensory team.
Hello.
Do you have any data about how many ECLOs there are around the country and in different hospitals?
Okay, so I'm going to be really honest with you, not to hand. I can almost tell you that there's not enough. There's massively not enough, but we can certainly see if we can find that data for you. If you could just, we come and take your name and email address, and we'll probably get back to you on that one. Oh, I've got somebody at the back who might know.
Yeah. Dave Williams from RNIB. It's around 100.
Right. Thank you.
So there's 100 ECLOs, and I'm wondering, so what's that in terms of hospitals? No. But...
Oh, we've Denise is the lady up the front.
Hi, it's Retina here. I'm one of the ECLOs and the 100th ECLO as well for RNIB.
Yay, well done.
I believe there's about 175 eye clinics around the country. Not sure if that's country including Scotland, but yeah, I think we're probably just gone over 100 ECLOs now. So probably about 108 at the moment, if that helps.
Thank you, appreciate that. Paula at the back.
Hi, I'm just wondering, it's Trish Wilde from Oldham. In the statistics that you were going through and the information you got, we've got the mobility as the main plus. Were there other areas around the rehab that were asked about or questioned about, or was it just mobility? Because it's interesting, that's the only thing that comes out of all the services we offer is a rehab service that's noted.
So Paula, just behind you as part of the project team, she's going to answer that for you.
Hi, yeah, we asked questions on a number of different services and accessibility aids. When we publish the full report, that data will be in there. We're expecting that to do that within the next couple of weeks. As Tina said, it is literally hot off the press and we wanted to bring it to you today. But yes, there will be more information about the support services and the aids that people are using.
Thank you, Paula. Denise?
Right, my name's Abu Bakr and I'm from Sight Loss in Greater Manchester, and I do Heritage Radio, North Manchester FM. Basically, I'm still waiting for my eye optician's appointment at the hospital in Manchester. How come people with visual impairment can't still get their appointment done unless it's a backlog of COVID-19? And what's the way around that? And how can people get involved with Retina UK?
So I think there was a question about how maybe to speed up a referral into an ophthalmic clinic and how people can get more information about Retina UK. Is that right? Yeah. Okay. So I think anecdotally, having spoken to clinician researchers, is that the pandemic has had a huge impact not only on clinical visits and backlog, but also research. So there is a massive push to regain momentum clinically. Sam De Silva, who's a consultant at Moorfields, a consultant ophthalmologist, that might be an interesting question to her, is how can you push through that system if you need to see your ophthalmologist? In terms of getting involved with Retina UK, you can visit a website, or if you would like to do that today, we've got everybody with the same jumpers as me, or if you just shout for a Retina UK member of staff, we will guide you right through that. Oh, maybe. Just run away.
I'm coming your way.
Hello. Hi, my name's Ruth. I'm an ECLO. I feel like I deserve a round of applause for that this morning. This is like one almighty loving session.
Absolutely, yes. I think we should.
But going back to what you were discussing about the fact that things have looked poorer for the last 2 years, I certainly know from my point of view here in Wales, throughout the pandemic, I was the only ECLO that was able to remain in clinic seeing patients face to face throughout the pandemic. And I know that a lot of we have a dedicated genetic clinic in Cardiff with a professor in genetics who's an ophthalmologist. So we're very, very lucky. But I can certainly see a correlation between that face-to-face support being not there and the sort of figures that you're showing. And I think it definitely reflects that having someone there as a point of information, whether it's at diagnosis or further down the journey, is hugely important. And I just can see those figures, and it makes me weep for the fact that so many of us weren't. I mean, I was very, very lucky, but it definitely to me shows a direct correlation between taking away that face-to-face support and the poor, like, negative impacts on outcomes for patients. Absolutely. I think, our even on a professional level, Zoom is an amazing tool, and in the pandemic it did an incredible job, but it's a very different communication than sat with someone in the same room. I completely agree. I think we've got a question at the back. Thank you.
We've had a question online. How many ECLOs support children, young people and families? Perhaps this is best answered by one of the ECLOs themselves.
I know in Wales what the situation is. I don't know if that kind of rolls out nationally, but I certainly know that probably about 50% of our service in Wales offers support to children. I certainly do. I have my own clinics working directly with a paediatrician and a low vision optom, seeing these kids through from birth. So yeah, I think a significant number of ECLOs do, but I do think there's definitely a gap in the market.
So, yeah.
Thank you. I'm yet another ECLO.
Hello. We've wiped out the ECLO clinics today, haven't we?
Yeah.
Sorry.
Are you going to be doing any research on the impact of virtual clinics on outcomes? I'm thinking basically because of the lack of face-to-face consultation, it seems to be pushing a lot more work the ECLO's way, because patients are not seeing doctors, and we're asking to refer on more and more since the impact of virtual clinics.
I think that's a really interesting point. There's one thing that we know at this stage, and this data is about 2 weeks old, so is that we need to do something about that downward turn on that point of diagnosis and in interaction. So I think that's a really interesting point that actually I'll take forward, probably with my RNIB colleagues. I think that's part of those. And we've got one at the front. I think yeah, she's coming.
Hi, morning everyone, it's Devinder from RNIB. So I'll be doing a session tomorrow on technology, but a work that has been happening in terms of, say, for example, in Moorfields, is the Attend Anywhere was a platform being used. And we all know there's a barrier, not everybody's digitally included. And we know that the pandemic had an impact. So there's work going on in saying, well, if you see an ECLO, or whether it's virtual, how do people who are digitally excluded get the choice of being in the community, maybe in the high street, a library? We're trying to be creative. So I guess the question is, moving forward, is this can all be fluid? It's a community-based thing, rather than saying, you know, it has to be one model. The accessibility of services has to be choice, and it's not a one size fits all, but there is work going on with that.
Thank you. Thank you. I think that's all we've got time for now. So I think we're going to have a break until 10 past 11. Yes. So I'm looking at Matt for reassurance there, because our first ever professionals conference, I didn't know if it was morning, night, noon, and everybody didn't know when to come back, but definitely 10 past 11, please, and we'll start our next session. Thank you so much.